Thank you so much. Good morning, everyone, and good evening and good afternoon, according to where you are now around the world. It's honor to present at this symposium. I'm Ngaboyase Roger, a cath nurse at King Faisal Hospital in Kigali, Rwanda. Today, I will share our nurse-led initiative to enhance access to catheterization service in Rwanda, a journey to address critical social determinants of health and promote equitable care. First, I'm going to acknowledge, I want to begin acknowledging the incredible contribution that made this initiative possible. My heartfelt thanks to Chantal Wamahoro, our Cath Lab unit manager at King Faisal, for her leadership, and my colleagues at King Faisal Hospital for their unwavering teamwork. And a special thank you to our cardiologists who advocate tirelessly for patients despite the limited resources available. If those people were not there, this case study and this initiative led by nurses would not be available. I really appreciate their work and how they kept encouraging us on working for the evidence-based nursing here at King Faisal. I also give I also give my sincerely appreciation to you, TS, for giving us opportunity to share our experiences around the world. This is keeping nursing a way of forward. I really appreciate that. I also give a special thanks to King Faisal for its extraordinary support that enable cardiovascular disease receive life-saving care. Regardless their financial constraints, we are building a legacy of compassion, equity, and transformation healthcare, honoring the shared responsibility to address disparities and uplifting impacted by systemic barriers. So let's begin our presentation with social determinants of health by making some of recall. Social determinants of health play pivotal role in healthcare outcomes. As nurses, we are at the forefront of addressing these factors. Equitable access, we work to ensure that healthcare reaches underserved population by removing barriers like cost and location. Community education, we empower individuals with knowledge about health risks and prevention. So that is the good thing that nurses do. They are always at the forefront. Without nurses, I think life cannot be possible at all. Nurses also, they do advocacy. We influence policies to reduce disparities and improve equity in healthcare systems. As our nurse leadership, we keep advocating for around the world for the government policies, for the systems that ensure the improvement of life for the people. So let me also introduce about our problem statement of our case study. Rwanda's only cath lab at King Faisal Hospital faces limited access, delayed referrals, and high cost, disproportionately affecting underserved population. These barriers result in advanced disease, presentation, and preventable complications. Addressing these challenges requires systemic innovations, with nursing playing a key role in tackling upstream social determinants of health. The nursing role in upslimming social determinants of health, the nurse-led initiative aimed to enhance access to utilization of Rwanda cath lab by addressing delays, financial barriers, and also knowledge gaps through community outreach, subsidized care, and telemedicine. It ensured equitable cardiovascular care, empowering nurses to tackle healthcare disparities and improve outcomes, especially for underserved population in resource limited setting. So by focusing on these areas, we thought to ensure that cardiovascular care is not just a privilege for a few, but accessible to all, particularly underserved population. So our catheterization laboratory here at King Faisal, it is the only one in Rwanda. But as you know, cardiovascular procedures, they have high cost. Some of the people in the remote areas, they struggle to pay for those services, and they are the one in need. I will share you the graph on how only the people in the city, they are the most who access our cath lab. So those in remote areas, they struggle to get our service. That's why Nurse Lady Initiative was established, and we started doing the case study to be the voice for those people who are in the remote areas, who are far away, who cannot access easily those services that are privileged for our country. So the case study overview, as I was introducing, Rwanda has advanced healthcare with specialized service like catheterization and cardiothoracic surgery. Here at King Faisal, our hospital is the only one in Rwanda who is providing those services. However, remote patients face challenges accessing city-based facilities due to limited awareness, delayed diagnosis, and financial barriers. Upstreaming social determinants of health, such as economic instability and geographic disparities, exacerbate inequities, requiring a systemic solution for equitable care. So our efforts were included in community outreach, educating and screening campaigns in the rural areas, plus training the local providers on how they can detect the cardiovascular disease early. And we created a channel where it will be easy for them to notify to the cardiologists, who are very few in our country, for savings those people in need. So financial accessibility, we also introduced financial accessibility by securing hospital funds thanks to our King Faisal Hospital that subsidized the care for low income patients. Those people with like STEMIs, rheumatic heart disease, they can just come when they have insurance. The hospital can cover the co-payments for those who are very poor and cannot pay for themselves. We also introduced telemedicine integrations, as I was talking about, by providing remote consultations to connect rural health facilities with our cath lab. So we have introduced a channel. It was really difficult in the beginning because we were only using the Google document. So because here in our country, we have almost health centers, those small clinic that are run by the nurses. There are 600 around the country, and most of the cases around the country, they come from those health centers, and they're the nurses who head all of those centers. So because we wanted to equip them with knowledge and also share with us those cases, we made it easy with them. Then we introduced a channel where they would be able to share with us those cases, and directly with cardiologists, so they can advise them on how they are going to transfer and refer those patients. As you see on the screen, this is the graph. This is the graph that shows the disparities in the inequity in a congenital heart patient in Rwanda by geographical location. That is a census from 2002, 2012, and 2022. As you can see on the graph, the yellow are the cases that are populated, gray are the census from different years. So as you see, the people based in Kigali are the only one, the only one who access easily the cath lab because they are knowledgeable and they have an easy access. But those people in remote areas, because in Rwanda, our country, we have 4 provinces and our capital city of Kigali. So the 4 provinces include the rural areas. So as you can see now, those provinces, the 4 provinces, most of the populations are based there. Kigali has a small population, but as you can see now, those people from Kigali here are the only one who access easily the cath lab. So that's why we put efforts in addressing those issues for helping those people from the remote areas to access easily our cath lab. The nurse-led initiative. So as I was talking also, we have also put efforts in community outreach. Together with our cardiologists, we have carried out education and screening initiative in rural areas. Despite there are few cardiologists in the country, but we made it possible, and we tried to train the local healthcare providers on cardiovascular disease risks and management. We'll also introduce, as I said before, financial accessibility to secure funds from King Faisal Hospital to subsidize care for low-income patients. We also introduced telemedicine integration. We established remote consultation and follow-ups, connecting rural health facilities to the cath lab. The impact and the outcomes, those shown. So the key achievement of that nurse-led initiative from 2023 to 2024, the 24% increase in referrals from rural areas because we began our initiative since 2023, and 15% reduction in late-stage cardiovascular disease presentation, and over 300 patients received subsidized care, and by reducing the financial barriers. So for us, we were really happy because this was a milestone, because we've never had those patients before. Most of the time, because of financial constraints, most of our patients were postponed and other died because of not getting enough funds to be able to pay for their procedures. But right now, as you can see, we've been able to operate above 300 patients. Health equity empowered nurses to advocate for the patient across the country with cardiovascular care. So there are also the challenges and lessons learned during this initiative. So the key challenges we have faced, despite our success, we encountered challenges. The first one was resistance from local providers. Some were hesitant to adapt to the new practice because we kept in mind that some of them have burnout and they had to care for many people. So going there and tell them on what to do was really difficult. And so they also needed incentive, and we didn't have enough funds to be able to pay all of those nurses. So some of them were really resistant, but as we continued with our case study and our initiative, we've been able to try to work with them. We also face the funding limitations. So sustaining subsidies required ongoing financial support. So because of financial support, it was really difficult to be, even right now, we still continued to go to these devout health facilities, but finding the funds for going around the country, trying to teach those healthcare providers at local areas was really difficult. Even though our hospital tried to help us with the transportations, with some of wages, but it was really difficult because it is a really huge project to go all around the country by addressing those issues and trying to teach those healthcare providers around the country. So the lesson learned, building trust with communities and local providers is essential. This would not be able to be carried out if we didn't have trust and collaboration with them. We tried to be effective in the communication, trying to explain our background and give them evidence-based. So they participate in this initiative by referring and looking for those cases with cardiovascular in need as their own, because they really knew the background of the problem and how they can help those people who have not enough fundings for accessing the care. And they are now the witness that they really participated in saving lives. That's why giving them trust and collaboration with them was the critical to the success of our lead NAS initiative. We also included partnership with stakeholders to enhance scalability and sustainability. Even though it is still not effective, but we tried to look for funds everywhere from the NGOs, from the government, by addressing those issues. So we've been able to have some little funds to be able sustaining for this initiative. We believe that we'll keep looking for that, and also try to look for the partnership anywhere possible for keeping this initiative alive. So for sustainability and scalability, we are looking ahead to sustainability and scalability are the key. Continued telemedicine consultation and periodic community outreach. For sustainability, we ensure that telemedicine consultation and community outreach that is alive and ensuring consistent access to care. For scalability, our model is adaptable for other regions in Rwanda and beyond, potentially informing national cardiovascular strategies. This work also has strengthened my advocacy skills, deepened my understanding of social determinants of health, and emphasized the importance of multidisciplinary collaboration in healthcare. So we really have a potential to inform national cardiovascular health strengths and advancing our advocacy all around the world where we can find help to keep our population alive. So the change in practice and perspectives. So the personal evolution, as I was said, it really strengthened me with my advocacy skills. I really appreciate this NAS-led initiative. And also it kept me with professional growth because it reinforced the importance of multidisciplinary collaboration in healthcare delivery. So the key upstream and social determinants of health factors. So the first one is those are the key pillars we look into. Economic stability. So reduce financial barriers through subsidized care. So
Hi,
those are
Roger.
the key.
We're about on time, so can you wrap up in about 1 minute?
Yeah, sure. So
Thank you.
economic stability, healthcare access, and health education. Those are the key pillars. So in conclusion and the key takeaways, NAS-led initiative can significantly address upstream social determinants of health, enhancing equity and improving health outcomes. So for call of action, it is simple. Let's prioritize equity in healthcare, ensuring that no one is left behind. Together, we can make a lasting impact. Thank you for your time, and I look forward for your questions. Thank you.